Good evening, everyone. Welcome to the MercyOne Cancer Education Series, sponsored by MercyOne Cancer Center and Above and Beyond Cancer. And this video podcast is brought to you through the support of the Iowa Cancer Consortium. And a real treat for us tonight, we have with us the Executive Vice President of the American Cancer Society for the North Region, David Benson, and also a good friend of mine. And David is also on the board of directors for Above and Beyond Cancer. Hey, Dave, greetings.
Greetings, Dr. Deming. It's good to be with you tonight.
It's great having you here. Where are you right now?
So I'm at my house in Stillwater, Minnesota. So not too far away, just a hop, skip, and a jump up north here. It's like 90 degrees, so
Great.
It doesn't feel like the great north.
So did you guys have a great weekend last weekend weather-wise?
It was. The smoke was gone, the humidity was gone. It felt good. It felt good to be outside.
So one of the things Dave and I are going to talk about is the importance of nutrition and physical activity as kind of, not only is it a mission of American Cancer Society to make sure that everyone knows about nutrition and physical activity as something very important in cancer control. It's very important to Above and Beyond Cancer. And personally, Dave and I both have personal life philosophies that bring that into play. But before we get there, so Dave represents one of, how many regions do we have now, Dave? In the American
Six regions for the American Cancer Society.
Yeah. So Dave, why don't you tell a little bit about yourself, where you grew up, and how you came to work for the American Cancer Society. And then we're going to really dig deep into what is the American Cancer Society, what role does it play in the United States in helping with cancer control. But first, a little bit about you, Dave.
Sure. So I grew up in Minnesota, have always been in a kind of active outdoor family, and graduated from Stillwater High School and then went to St. Olaf College for my undergrad. Coming out of my undergraduate degree, I actually went to seminary for a short period of time. Decided that I needed to get a little life experience before I was going to make that a career choice. So I actually then pivoted to a little short stint in politics. I was running some campaigns in Minnesota in the late 90s, and coming out of the 98 election year, I had applied to public policy school and was planning to go to the University of Minnesota to get my public policy degree. I needed a job to kind of bridge me through to when school was going to start. And I actually looked in the newspaper and saw an ad for a job at the American Cancer Society. And this was in 1998. Minnesota had just settled with the tobacco industry to, for the tobacco settlement dollars, and Minnesota did that separate than the big national settlement. So there was going to be a legislative fight to get dollars set aside from the tobacco settlement for tobacco control. And they needed someone to come in and work with volunteers and help do the advocacy work around that campaign. And so I thought that sounded like it was right up my alley. And I applied for the job and got the job and worked the 1999 legislative session. And we successfully got tobacco settlement dollars in an endowment that are still being used today for tobacco control in the state of Minnesota. And needless to say, I was hooked. And I've been working at the American Cancer Society ever since. I delayed my academic career a little bit, ended up getting an MBA instead of a public policy degree, and I've just been really stimulated by the work here at the American Cancer Society. I've done everything from advocacy work to cancer control work to a lot of fundraising, marketing, communications, worked with volunteers, partners. It's just been an incredible journey.
Yeah.
And it feels like there's always a way to make a contribution. And I joke with people, if you ever get bored working at the American Cancer Society, you're not trying hard enough.
Yeah. Well, thanks for, that life story. And, it reminds us all that who knows where we're going. And, you think when you graduate from high school, oh my gosh, I've got to decide what major, and that's this life It's such an important decision, and we realize as we live our lives that we take so many different directions. But I like the idea. Obviously, you've got this spiritual essence to you that I've
Yeah.
known. We're going to talk about the fact that Dave and I have climbed Mount Kilimanjaro together with cancer survivors, and that being involved in cancer care, I mean, there definitely is a spiritual dimension, because whenever you're talking about cancer, the idea of mortality comes into play. And
Yeah.
as Plato would say, the contemplation of death is the bedrock of spirituality. So having a spiritual essence is important, but also your advocacy. I mean, American Cancer Society is like a advocate on steroids when it comes to what it does in terms of cancer control. And let's go a little bit into the American Cancer Society. So I've been a cancer doc. I've been a doc for 40 years, and a cancer doc for 35 years. And I will tell you, there's a lot of good cancer organizations out there, including Above and Beyond Cancer, but there is
Yep.
no cancer organization out there that walks the walk and talks the talk and puts real work into helping from a global perspective, an American perspective, a policy perspective, a treatment perspective, and a patient care perspective as the American Cancer Society. There's just no organization out there like that. Dave, why don't you tell us a little bit about, the beginning of the American Cancer Society, this 100+ years, and a little bit of the history of the American Cancer Society for those people who may not know it.
Yeah, so the American Cancer Society was founded in 1913 in New York City. It was largely a group of healthcare professionals and philanthropists that got together and said we needed to do something about this disease. And what you have to know about cancer in the early 1900s is that no one talked about it. It was a disease that virtually always led to pain and suffering and death. And so it was a stigmatized disease that no one really wanted to talk about. And so the American Cancer Society started really as a way to get information out about cancer. Even back then, there was some things that doctors felt people needed to know about, things that might be early warning signs that cancer might be something you're dealing with. And they wanted to get you to see your doctor as soon as possible if some of these warning signs were there. And so ACS literally started as a way to get information out to the general public. And what I love about the early days of the American Cancer Society is that it was largely volunteer based. It was volunteers that were literally going out into their communities and spreading the word. And that led to something that was referred to as the Women's Field Army. And this was literally thousands of women across the country who went door to door, spreading the word about cancer and trying to get people educated and to start to destigmatize this disease, because it was something that people just didn't talk about. Even my own grandmother, who was a breast cancer survivor, was diagnosed in the 1960s. It was not something she wanted to talk about. And fast forward to today, I think we celebrate cancer survivorship, and we're people are proud that they're able to go through this journey and survive this disease. And so the American Cancer Society, that has been a big part of our mission. As we grew in that information work, one thing we realized is that we didn't have enough information. And so in the 1940s, there was an amazing volunteer that decided we needed to do more in cancer research. And so the American Cancer Society launched a cancer research program in the 1940s to learn more about cancer. And a lot of that was basic science, so things you'd see with test tubes and laboratories, but also epidemiology. And so we have done multiple what we call cohort studies, cancer prevention studies, where we look at really big groups of people and look at what's going on in their lives to see if there's any correlation between their lifestyle and cancer. In fact, the very first study the American Cancer Society did like that was the Ham and Horn study, which linked tobacco use and cigarette use to lung cancer. And so these studies then gave us more information. We were able to spread more details to the general public about cancer and make that all work. As we did more in cancer research, we knew that there were campaigns that we should be doing to take the information we knew and really apply it in the general public. And so we became one of the leaders in the tobacco control world. And that became a big part of what we were doing all through the 80s, 90s through today, trying to help people understand that this is the single most important thing you can do to reduce your cancer risk is to quit smoking and not use tobacco products. And so the American Cancer Society did a lot of advocacy work, a lot of public awareness work. So that has been a big part of what we do. And then, of course, we also want to be there for cancer patients. And so as we start to learn about gaps that cancer patients are facing as they're going through a cancer journey, the American Cancer Society has wanted to be there to help. Information is still critical. So, our website, our 1-800 number are some of the most used resources by cancer patients and caregivers as they're trying to figure out details about their cancer journey. Literally millions of people are going to our website and calling us every single year, and we want to be there for them. We also have patient services and programs that we offer. Hope Lodge, for example, like our Hope Lodge in Iowa City, where cancer patients can stay overnight free of charge while they're going through cancer treatment. We have over 30 Hope Lodges across the country. We have a Road to Recovery program where volunteers drive patients to and from treatment. So that has been a big part of what we do. And lastly, I would just mention where I kind of started is our advocacy work. And we've known for a long time that we can help one person at a time, which matters. It really matters. But we also can impact an entire population through our advocacy work. And so when we can pass a smoke-free law, for example, we can impact an entire state population by limiting people's exposure to secondhand smoke. So advocacy became a big part of what the American Cancer Society does. And in the early 2000s, we actually formed an advocacy affiliate called the American Cancer Society Cancer Action Network, where we recruit volunteers and, we are a force contacting members of Congress, local legislators, even city councilors, when we think that there's an opportunity for us to pass public policy that would reduce the cancer burden. So, that's a kind of a whirlwind breeze through all the things the American Cancer Society has been doing for 108 years. I'm happy to delve into any more details, Dr. Deming,
Dave,
if you
we're going to go into more of those details. Just to reflect a little bit, you talked about your grandmother's experience. My mom was diagnosed with incurable lung cancer. I was a junior in high school in the 1960s. And you're right, we've come a long way. As you pointed out, there was a huge stigma to having cancer. It wasn't something you shared. It was something just perversely you were ashamed of.
Yes.
And it was like a black spot. And I also remember probably the very first memory of American Cancer Society was small town in South Dakota, 500 people, and a manila envelope that was passed from house to house, and you put in a few bucks and you took out a little sword of hope, a little plastic American Cancer Society sword. And you just passed the envelope down the block and it went to the next block and people put in a few bucks and took out a little sword. So that was my first experience. And you think at where we have come, not only by having a national organization like the American Cancer Society helping to, lead the charge to destigmatize cancer, but then the beginning of research. People today don't probably truly comprehend that basically we had surgery and we had some radiation and then chemotherapy developed, but there weren't cancer centers and there weren't cancer wards. And then the role the American Cancer Society played were starting to just interview and survey people on their lifestyles and then follow them over 10, 20, 30, 40, 50, 60 years, learning how various lifestyle activities either protect it or increase the risk of developing cancer. Huge influence. And as you pointed out, that's the way we learned that tobacco causes cancer.
Yeah. Yep.
And then jump forward to today. So let's talk about the American Cancer Society Day. And I love the point about the American Cancer Society Cancer Action Network. As
Yep.
you know, Dave, I had the honor of serving as the national chair of the American Cancer Society Cancer Action Network, the advocacy arm. But even before I was on the board, I had the opportunity, like many volunteers. And so my role with the American Cancer Society has always been as a volunteer. And like many, many volunteers, once you get doing something as a volunteer and you realize how important it is and what a role you play in advancing cancer care and cancer control, you have the opportunity through the American Cancer Society to advance up to national leadership roles as a volunteer. I remember very distinctly, let's talk a little bit about the role the American Cancer Society played in the Affordable Care Act.
Yeah.
So let me just tee it up, but American Cancer Society has always been concerned about access to care. I mean, you can have the best cancer treatment ever, but if patients don't have if it's not available to patients, then it doesn't matter. So American Cancer Society has not been just about helping to fund research to find a new cancer drug. It's always been also about how do individuals, how can they get access to the care? So American Cancer Society was all in when it came to advocating for a healthcare system that would provide access to care. And Dave, maybe you take it from there and how the American Cancer Society used their kind of their own mission philosophy to get behind advocating for the Affordable Care Act.
Yeah, I think it's a really important story. I just would start by saying that, our advocacy affiliate, ACS, what we call ACS CAN in short, is a nonpartisan organization. And so, but as a nonpartisan organization, when you're in politics, you have to navigate that very carefully. And so obviously the political debate over affordable healthcare was very political. And so what the American Cancer Society decided to do was to really put forward some criteria that we would weigh lots of different options for providing more access to healthcare. And we weighed all these different proposals against these criteria to really make it objective. And it wasn't that we wanted to say one was necessarily better than the other. What we wanted to say is, does it really do the things we needed to do? Does it increase access? Is it affordable? Is it easy to use? And by having those criteria, I think it allowed us to say, hey, you have an idea? Let us take a look at it. We'll let our experts review it and really put it up against these criteria, and we'll be objective about this. And at the end of the day, as the Affordable Care Act, or what came to be referred to as Obamacare, was going through the legislative process, that was really what we try to do, is be objective, be informed, be science-based, but also be honest that this is there's not an option not to do something. We have to do something because there's too many people in our country that did not have access to affordable healthcare. And so I think we navigated that pretty well. Some people did not like the American Cancer Society stepping out and taking a strong position on an issue that for many seemed very political. But for our mission, we had to. I mean, our mission demanded that we be bold and direct and really stand on our own 2 feet and take a position on this. But this wouldn't have happened if we didn't have an army of volunteers who understood this issue, were passionate about this issue, were willing to pick up the phone, their keyboard, contact their elected official, say how important this is. Because there were, if you remember back then, there were many elected officials that didn't know which way to vote on this. And when they heard from constituents, and when they heard from cancer docs like you, Dr. Deming, they started to say, yeah, this is something we need to do.
Yep.
And
And when they heard from voters as well, as you pointed
yep,
out. Yes, yes. You know, I think back on that time, and again, I reflect on the fact that as a cancer doctor, I have the opportunity, one patient at a time, as I go from
mhm,
room to room to
yep,
room, to have an impact on cancer control. But with as an advocate and as part of the American Cancer Society Cancer Action Network, to be able to influence legislation,
yeah,
you can change millions of lives
yes,
in the course of public health policy. And so I feel just doubly blessed to be able to do it one person at a time, but then also through
yep,
the power that we get through the American Cancer Society Cancer Action Network, which just gives us a bigger soapbox and a louder megaphone, and gets our voice amplified. And just a couple of personal reflections. One was being able to speak in front of the assembly of the Senate and the House up at the State House in Iowa, and to be able to reflect on how many of my patients have suffered because of the lack of affordable health care, and how it became for me a real issue of human dignity to make sure that we had a system in place that allowed affordable health care. And then I think back maybe 4 years after that, as the expansion of Medicaid came
yep,
to each state, because the Affordable Care Act really built into that was to provide some of the affordable health care through the expansion of Medicaid. And through my association with the Cancer Action Network and the American Cancer Society, getting to sit down with Governor Branstad one-on-one and just have an honest heart-to-heart talk about the difference it would make in saving lives if Iowa took up the expansion of Medicaid. And the ability that not only the American Cancer Society, but other organizations, but for me, it was always the American Cancer Society and Cancer Action Network helping us get the audience and the
yeah,
opportunity to make our voices heard.
yeah. Well, when you've been around as long as we have, I think we have built up some brand equity. We've built up some street cred. I think people tend to listen. We publish a report every year called Cancer Facts and Figures, and it is the most cited, you know, uh, scholarly article in the cancer world. It's also cited a lot by, our mainstream media. Every time you hear a report that says this many people will be diagnosed with cancer in the state of Iowa, it's probably Cancer Facts and Figures are citing. So we've built up some equity and some trust by the general public, and I think our elected officials. And so when we make our voice heard, um, people listen, and that's why we're very careful about what issues we weigh in on, and we want to make sure that we can bring an objective and science-based approach to whatever that issue is. And I think we've done that again and again, and we've seen progress on that.
I want to talk about 2021, but before we do that, let's just look back at another victory and various victories across the United States that the American Cancer Society Cancer Action Network has been involved with. And I think of here in Iowa, the smoke-free legislation and the passing of that, and American Cancer Society Cancer Action Network has been involved in many states and helping to work
Yeah,
for tobacco control and tobacco-free laws. I think back, and I should know the year, but I can't right off the top of my head, but it was over 10 years ago
yeah,
when Iowa passed the smoke-free law that made
yeah,
smoking in public places illegal.
yep,
Huge advance forward in public health. And that's happened across the country in many states. And, the arguments against, oh, how can you outlaw smoking in bars and smoking in restaurants? They'll all go broke. And I don't know anybody today that complains about being able to be in a restaurant and to have a meal without smoke, or being in an airplane, or being in
yeah.
a public space. Maybe you might want to elaborate a little bit more on the American Cancer Society's role in tobacco control across the country.
Yeah, I mean, it's really all about culture change. I mean, we had a culture that sort of accepted that this was just a part of our life, that tobacco use was normal and it was around you all the time, even if most people, and data showed most people knew it was extremely bad for them. And we were seeing reductions in tobacco use rates all through, really from the 80s, 90s, 2000s. And so smoking really was becoming less and less of a normal thing in our culture, yet we were still sort of allowing it to pervade all aspects of our lives. And I think finally we were able to create a culture change around tobacco use, where it's not, those of us who don't smoke, we don't want to be breathing secondhand smoke. And we were able to, help that culture change happen. And it took, like most public health, it starts in certain states like California or Massachusetts. Minnesota is often an early adopter state. Early in my career with ACS, we were literally going city by city in the state of Minnesota and getting city councils to pass smoke-free laws. And eventually we got enough cities that in a county, and then the county would pass the law. And then we got enough counties that the state finally passed a law. And then after a number of states, in an area passed those laws, then other states started passing more laws. So it really became kind of a grassroots effort, truly. I mean, there hasn't been probably a better example of a grassroots-led effort than what we've been able to do in the world of tobacco control.
Yeah.
And with that culture change has led to some of the steepest declines we've seen in tobacco use. And that is the number one reason that we can stand here today and say we've seen over a 30% reduction in cancer mortality since it peaked in the early 1990s. Think about that. 30% reduction in cancer mortality since the early 1990s. From the inception of the American Cancer Society till 1992, cancer mortality rates went up every single year. And since 1992, they've come down every single year. So we are living in this kind of golden age of progress in the fight against cancer. And a big part of it is because we've been able to, really take a lead on tobacco control. But there's so many other things too, which we can get into.
Yeah.
But I just think that's such a cool thing to think about, that tobacco use alone has been the single leading reason we've been able to reduce cancer mortality rates in this country.
And before we leave tobacco and talk about some of the other achievements, and then talk about some of the current barriers, as we would say, the obstacles, what are we dealing with today in 2021? Just talk about culture change, just as we talked about the stigma of cancer back in the 60s.
Yeah.
I was born in 1953. I have a brother a year older. I remember I would have been in probably kindergarten. Both my mom and dad smoked. They were good people. It wasn't illegal. It wasn't immoral. It was about 50% of men at that time smoked. And our Sunday evening family activity would be mom and dad and my brother and I sitting around the kitchen table, rolling cigarettes for mom and dad to smoke during the week. That was our activity. Mom and dad both died of cigarette smoking. They were each 52 when they died. Mom died of lung cancer and dad died of sudden cardiac death, but it's related to tobacco. But the change that's been made, I mean, nobody thought anything about having your kindergartner roll cigarettes and driving a car without seat belts with smoke coming, throughout. It wasn't, it was a culture then. We didn't even know at that point how harmful it was. And certainly we didn't know about secondhand smoke and third-hand smoke. And so the culture has changed, and with that has come public health, and with that has come saving lives.
Saving lives. That's right. That's what's so amazing.
Let's jump to 2021. So we haven't come through the COVID pandemic. We're still dealing with it. And that has presented some very difficult challenges to cancer patients and to individuals getting their services, preventive services, their screenings. Maybe talk a little bit about what we've faced in the United States. I know the American Cancer Society did a very seminal survey on the role that that COVID played in cancer screening and cancer care. maybe talk a little bit about that, Dave?
Sure. Yeah. So early in the pandemic, it was very clear we all talked about, flatten the curve. And we wanted to give our healthcare workers the space to be able to deal with what we anticipated would be the need for a lot of healthcare services to treat COVID. And so, I think everyone put off certainly elective procedures, but even some preventative services, because we didn't know if healthcare systems, doctors' offices would be a potential point of infection. And so even the American Cancer Society came out and said, take a break, like just go home, like flatten the curve. We were all, I think, unified around that public health message. But unfortunately, I think, it's easy they say it only takes like 2 weeks for people to form a new habit. And I think a lot of people did not go to the doctor last year for good reasons. But, what that led to was a steep reduction in people that were getting their routine cancer screenings, a steep reduction in people going in for their annual checkups. And so we're very concerned that that's going to lead to a number of later stage cancer diagnoses as people get back to their routine screenings and physicals. And that's a concern, because later stage cancer diagnosis is harder to treat and certainly has poor outcomes. And so we are really working hard to try to get people back to their doctors and get people screened again. We actually started by calling this return to screening, but we realized there's a whole lot of people that probably, turned of an age where they should start thinking about this in 2020. And for them, it's not just about returning to screening, it's about getting screened for the first time. So we've been doing a lot of public awareness around Get Screened. We've been working with healthcare systems, doing provider education, doing strategies like quality improvement initiatives. We can get into that if you want. Things that help our healthcare systems work side by side with the American Cancer Society as we're out engaging the general public, trying to get people back into their doctor's office. But this is a really important priority. The American Cancer Society has been on the forefront of really looking at cancer screening for a long time. We actually put out screening guidelines. So if you're ever curious, like what cancer screenings should I be getting, our website is a great resource. First and foremost, so please be talking to your doctor. Your doctor's going to know what unique health situations you have, family history. All these things get factored into when you should start breast cancer screening or when you should start colon cancer screening. When you might want to consider lung cancer screening if you're a longtime smoker. So the American Cancer Society puts a lot of science behind the guidelines that we publish to say which screening modalities are the best and how often you should get them, when you should start them, how often you should do them. And that is the message we want to get out, is that people should get screened, period. If you missed it last year, try to get back on schedule. There's plenty of capacity out there to get people screened, so we want to get that going. Even with Delta variant going on right now, I know there's plenty of places that are doing mammograms and colonoscopies are they're making it happen. So we got to get people screened because it's going to save lives.
Yep. So a couple of points that I'd amplify. Number one, American Cancer Society has a scientific division that looks at the science of what screening tests really save lives, and mammography and colorectal cancer screening saves lives. So we know that from the science. And then they also use science to develop when should you start getting your mammograms or your colorectal cancer screening or your lung cancer screening or your pap smears, and how often. And that evolves over time as the science changes. So number one, American Cancer Society has been the go-to place that cancer doctors look to for guidelines. Second, American Cancer Society, as Dave pointed out, this year is spending millions of dollars on public service campaigns to get people the information they need to get back to screening. It saves lives. Just yesterday, I met a patient who had just turned 40, had her very first mammogram, and it detected a cancer, early stage. It's going to be cured, but had she not had that, had she turned 40 last year at this time, she may not have been able to get the mammogram because we were still dealing with our how we're going to take care of all the COVID patients. Maybe we better keep people from coming into the medical centers. So a couple of points there about screening. Let's talk about prevention also. American Cancer Society is really about looking at cancer control, meaning trying to prevent cancers, trying to find cancers in an early stage, trying to cure those cancers that are curable, provide ongoing care for patients that are either cured of cancer or who have incurable cancer. So back at the one end of the spectrum, we talked about screening. And so let's just also shout out that not only is it mammograms to screen for breast cancer, but colorectal cancer screening, which is looking for blood in the stool or doing colonoscopies. And for those who are smokers, it's doing screening CAT scans of the chest. And for early detection of cervix cancer, doing pap smears. So those are just some of the ways that we advocate for screening to find a cancer at a detectable. Let's shift a little bit and talk about cancer prevention. And one of the programs that our cancer center has partnered with the American Cancer Society on is in the HPV vaccination. So just a little background for those who may not be aware, HPV is the human papilloma virus. It causes about 7 different types of cancer in the United States. 100% of cervix cancers are caused by HPV. A lot of oral cavity tonsil cancers in men is caused by HPV. A lot of cancers of the anal canal, of the vulva are caused by HPV. So a lot of cancers caused by HPV. And now we have a vaccination that it can actually prevent those cancers. And the American Cancer Society has really been a huge partner in helping to promote HPV vaccination as a way of preventing cancer. Dave, maybe you want to say a few more words about HPV vaccination and the role the American Cancer Society has played.
Yeah, I mean, when I started in the late 90s at the American Cancer Society, we used to talk about imagine a day when we would have a vaccine for cancer. And we would talk about that as a, as kind of a pipe dream, as something that, we would raise money to get to that shining point on a hill where we'd have a vaccine for cancer. And here we are, within my career at ACS, and I hope I have a lot of years left. We have it. We have a vaccine that, like you said, is effective at preventing 7 different types of cancer. And to me, it just seems like it's almost miraculous that we have it. It's just amazing that we can give shots and cancer won't happen. And so, the American Cancer Society has been, again, trying to, like we've been doing for over 100 years, get information out about why this is so important. A lot of it is educating parents, but also educating primary care physicians and pediatricians on how to talk to parents about when to get their kids the vaccine, when it's the most effective, why it's so important. And it's been, I think, a successful effort. We still have a long way to go. There's, like I said before, public health kind of works, in a rhythm where we see certain states getting their vaccination rates up really high and other states are maybe lagging behind. And so there's a lot of effort around education, but also, really trying to make sure that this is something that people understand is science-based and proven and is a really effective way to prevent cancer. So it's a big part of what we do and will continue to do. And, now, as I know, a lot of parents are getting ready to send kids back to school. There's probably some well-child checks that are happening, and I'd encourage every parent to be talking to their physicians about HPV vaccination and how it is an incredible way to keep their kids safe.
And again, the American Cancer Society's role, they're one of the organizations that spearheaded a roundtable of experts
Yep.
around the country. So, you know, ACS didn't discover the virus and didn't develop the vaccine, but one of the things that they've really done in science is look at what are the best practices that some pediatricians are able to get nearly 90% of their kids vaccinated, and other pediatric offices are down in the 10%. What are the best practices? And then in studying all of the different ways in which pediatrician and family practice doctors talk to their patients about vaccination, learned what are the things that a doctor can say to a patient that will make the difference between them getting vaccinated and not vaccinated, and then developed a cool tool kit and basically trainers that really made a difference in going out to family practice docs and pediatricians and teaching them what's the best way to interact with your patient that results in patients getting vaccinated. So that's just another example of what the American Cancer Society has done that has helped to promote prevention of cancer.
Yep.
We're also talking a lot about these days about other things to prevent cancer. We've already talked about tobacco. Alcohol is coming into play. We're learning more and more. I think there was a time where we thought that maybe there was a net benefit of alcohol drinking, not necessarily in cancer, but overall health. There's no doubt that alcohol can provide great quality of life benefits, but we're learning more and more about the role that alcohol plays in actually contributing to some types of cancers. And we're learning a lot about how obesity and physical inactivity leads to cancer. In the United States, tobacco causes about 1/3 of all the cancers. But right behind it is that triad of too many calories, obesity, and lack of physical activity as a cause of cancer. So American Cancer Society is now, it's not just about curing cancer, it's how do we prevent cancer? And the American Cancer Society is all in on educating individuals about the importance of nutrition and physical activity. Dave, you want to say a few more words about the ACS's role in that?
Yeah, I mean, well, some of it is doing the research on how many cancers really are linked to those things that Dr. Deming just spoke to. And I think our best estimate right now is about 18% of all cancers in the United States are related to things like nutrition, physical activity, and obesity. And so, think about that. That's a lot of cancers. And, if we could change lifestyles where people, are eating healthier, are staying physically active, are keeping their weight or BMI at a healthy level through their lifetime, that would reduce a lot of cancers. It would be significant in terms of the amount of lives saved. And so, one of the things we're trying to do is make sure that those guidelines are published and are available for people to see and for physicians to be able to talk to their patients about. You can learn more about that on cancer.org. You can put in nutrition and physical activity guidelines for cancer, and likely it's going to be American Cancer Society information that comes up. I mentioned those cancer prevention studies that we've been doing since the 1940s. Well, our second cancer prevention study is really where we've gotten a lot of the science and data that proves that these things like what you eat and how much you exercise directly links to your cancer risk. And so, this is not, made up. I mean, we all sort of intuitively know we should be physically active and eating well. We shouldn't be eating pizza every night. We probably should be eating more vegetables. But there's science behind that, like good, hard science over many, many years to prove this out. And we keep learning more. And so I think it's one way. Some people are very much convinced that when they see the science, they'll they can change their behavior. Truthfully, though, it's a lot harder than that. I think, everyone struggles with, eating right, exercising. It's hard. It's not an easy thing to do. One of the reasons why I love the work of Above and Beyond Cancer. I think that Above and Beyond Cancer is really showing people what a joy it can be to live a healthy lifestyle, to be active and outdoors, and thinking about the things you eat, and how that can make you feel so much better every single day, and live each day to the fullest. And so, it's tough because we've got so many other things in our lives sort of telling us to go grab that unhealthy thing to eat, to drink that soda or energy drink, or eat that hamburger, or instead of eating the things we know we should eat. But at the end of the day, it's such an important part of cancer prevention, and we've got to just keep chipping away at it.
Yeah. And, we used to, as cancer doctors, somebody going through their cancer treatment, it would be, oh, take it easy, take some naps, eat some bonbons. And, now it's like, I'm sorry you have cancer, but, for example, early stage breast cancer, 85% of women going through early stage breast cancer. So the cancer is detected on mammogram. They don't have any symptoms from the cancer. They get on the conveyor belt of cancer treatment that leads them through surgery and radiation and anti-estrogen, and they come off the other end cured of cancer. But 85% of those women will have gained 20 pounds or more going through the cancer treatment. And they end up, after the cancer treatment, less healthy than they were before. It doesn't have to be that way. And part of it is, with sympathy, with empathy, with compassion, saying, I'm sorry you have cancer, but this isn't the time to give up your physical activity. And that studies show that if you continue physical activity while you're going through your cancer treatment, you will have better outcomes, better cure rate, fewer side effects, and you don't have to put on the extra 20 pounds. And part of that is work done by the American Cancer Society.
And Above and Beyond. I mean, I still, we haven't talked about it yet, but the experiences I've had with Above and Beyond Cancer, and, taking cancer survivors to the top of Mount Kilimanjaro, and, people that were in active treatment, people that were long past their cancer treatment, but all of them, pushing the boundaries of physical activity to a whole nother level, and finding joy in that, but also being healthy in that. And that was just so fun to be a part of. Life changing.
Yeah, even our concept of healthy, I like to think of sort of an analogy. Let's take a 65-year-old woman with stage 4 breast cancer with some bone metastases. It's incurable, and she is on treatment that's keeping the cancer under control. She's maintaining her body weight. She's physically active. She's climbing mountains. She goes to church, and she has a great group of friends and belongs to 3 book clubs. And then let's take that and compare that to a 35-year-old individual who doesn't have cancer, who doesn't have any disease that's likely to result in death, but they're 100 pounds overweight. Their only activity is sitting on the couch watching TV. They don't have friends. They don't go out of the house. They haven't read a book since they graduated from high school. Who is healthier, the person with incurable cancer or the person who doesn't have a life-limiting disease? Well, clearly, the being healthy is so much different than just determining whether you have cancer or not. And finding joy the same way. We find joy through challenges in our life, and whether eating the right food causes less cancer or not, it certainly can provide a better quality of life and provide joy. And as you know, those are kind of personal philosophy you and I hold. And one of the tenets of the personal philosophy of Above and Beyond Cancer is, how do you take a bump in the road of life and let it be a springboard and not an obstacle?
Yeah, you've talked about post-traumatic growth with me, and it's always resonated. And for a lot of people who face a cancer diagnosis, they do. It's a wake-up call, and they start eating better and exercising more. I wish it didn't take a cancer diagnosis to have people realize that you could wake up tomorrow and make those choices. And if you did make those choices, you reduce your risk of chronic disease. You'll feel better. You'll live each day to the fullest. It shouldn't take a cancer diagnosis for people to see that. Sometimes it does. Sometimes that's what it takes. But everyone can make those choices. It's not easy. Trust me. I'm not trying to say it's easy. It's hard. I mean, it's hard for everybody.
We've got a few minutes left. I think we're going to end. Let's talk about 2021. And Dave, maybe I'll invite you to introduce us to the brand new president of the American Cancer Society, and then talk about some of the prime issues that American Cancer Society is working on right here and now. We've gone through a period of time where not only are we dealing with the pandemic of the virus, but we've gone through a time of cultural, racial, equality issues that have really come to the forefront and as well. So maybe take a few minutes to talk about the new leadership of the American Cancer Society and some of the issues that the American Cancer Society is dealing with right here and now in 2021.
Sure. Yeah, so I'm excited to introduce everyone to Dr. Karen Knutson. Dr. Knutson is the new CEO of the American Cancer Society. She started, I think, 76 days ago today. I was just on a call with her, and the reason she mentioned that is she's from Philly, and Philadelphians evidently like the 76ers, right? So that's how I know exactly how many days she's been on board. She is amazing. She was running the Sidney Kimmel Cancer Center, which is a big NCI, National Cancer Institute designated comprehensive cancer center, treating many, many patients. She is a researcher by training, PhD researcher, and actually was funded by the American Cancer Society early in her career. So the work that we do at ACS is near and dear to her heart. She has jumped right in and has launched a strategic planning process to, I think, really help the American Cancer Society to define where we're going to go, where we want to, the vision we have for how we can influence the progress we're making in the fight against cancer, not just this year, but next year and long into the future. So we are really trying to define our work in 3 pillars right now. Stuff we've been talking about during this call. One of those pillars is discovery, which is all about cancer research and continuing to push the envelope on learning as much as we can about this disease. The American Cancer Society has invested $5 billion in cancer research since the 1940s. And we have a pretty good track record through what we call peer review of identifying some of the very best and brightest researchers in the world. In fact, 49 researchers that were funded by ACS early in their careers have gone on to win the Nobel Prize. So we want to continue to fund those scientists. On that topic of diversity, equity, and inclusion, one of the things that we want to do within our cancer research space is really boost the number of diverse scientists going into the field of basic science and research. And so we've actually been starting to fund internships at historically Black colleges and universities. We're also going to be doing some funding for where we have, like, at institutions that are doing cancer research all over the country, not just at HBCUs, where we can do more internships for diverse students that are interested in going into the sciences. So that's been something that I've been really excited about, because there is a lack of diversity in the field of cancer research. And so if we can improve that, I have to believe it's going to improve the way we do research, how the research gets done, and of course, lead to faster discoveries. So that's exciting. Another pillar is the whole area of patient support. Now, this is You think about patient support, of course, we're thinking about how we can support cancer patients going through their cancer journey while they're in active treatment, but it's also all the work we talked about in prevention and early detection. We really want to think about how the American Cancer Society can be a leader across that cancer continuum, from those prevention things we can do to hopefully reduce our risk of cancer through early detection, all the way through, if needed, cancer treatment and survivorship. And so, lots to talk about there. We talked about that a lot, so I won't go into a lot of details there, other than to say that we are really ramping up our work in reducing cancer health disparities. We see the data that shows that really more and more there's, whether it's race, ethnicity, socioeconomic status, these things contribute heavily to your likelihood of being diagnosed with cancer. We see these disparities playing out. In fact, one of our former chief medical officers used to say, often it's your zip code that plays a bigger role in your likelihood of developing cancer than your genetic code. And so that's scary. And that's something the American Cancer Society wants to take a leadership role on. And certainly we've been doing a lot of research on that and publishing on these data points that show that this is a very, very real problem. Because the last thing we want, you mentioned this, Dr. Deming, is to come up with discoveries that only a small percent of the population can afford. If we have these breakthroughs that can save lives, we want people to be able to have access to those discoveries. And then the last pillar is the whole pillar of advocacy, which we've talked about a lot. I would encourage people to get involved with our advocacy efforts. It's easy. You can join ACS CAN. We will contact you when there's an opportunity to weigh in on these important legislative issues and help us get these laws passed and save lives. And we really do believe that that's going to be a really big part of what we do long into the future.
Yeah, and that's a great way to end it, with the fight back. We're always about celebrating the achievements, and we did a bit of that today. We're also about remembering those that have died of cancer, your grandmother, my mother, but it's ultimately then about fight back. How can we make a difference? And part of it is advocating for good healthcare policy. So if you become a member of the American Cancer Society Cancer Action Network, and Above and Beyond Cancer is a member, and every year I personally, along with other members of Above and Beyond Cancer, go up to the State House here in Des Moines and advocate for public health policy that's going to reduce the burden of cancer. That happens in all 50 states. So seek out the American Cancer Society Cancer Action Network, go to the State House, and then once a year we go out to Washington, D.C., and we go knock some heads together and use our power of persuasion. Cancer survivors especially, telling their story is so persuasive, and it can get legislation passed. So thank you, Dave, for being with us. Again, I'm Dick Deming. I'm the medical director of MercyOne Cancer Center, and I'm a volunteer for the American Cancer Society and founder of Above and Beyond Cancer. Dave Benson is executive vice president for the North region of the American Cancer Society, and is also on the board of directors for Above and Beyond Cancer. And Dave, it's been such a pleasure speaking with you, and thanks so much for being with us this evening.
It's been my pleasure. I hope everyone hears a little bit of fun in our voice too. Fighting cancers can be a whole lot of fun when we all put our heads and minds and bodies together. We can get a lot done. So we have some fun doing it.
That's right. And those here in the room with me are going upstairs now. We're going to change clothes and do a spin class and engage in physical activity to help reduce our chances of getting cancer. So thanks again, Dave. And for our audience, thank you for participating. If you want to watch this again or send the link to friends, you can find this on the Mercy Cancer Center website, or you can go to the Above and Beyond Cancer YouTube channel, and you can watch it and find the link and send it to friends and family. We'll see you all back again next week. Thanks for joining us.